New York Governor Andrew Cuomo met with President Trump today about large-scale testing in the country. I'm Jesse Tenor in Washington, and I'll have that story coming up.
The president announces he's going to issue an executive order for an immigration ban during the coronavirus. I'm Joe Khalil here in Washington. What that's actually going to mean and why the other side of the aisle says this is purely politics.
I'm Raquel Martin in Washington. To ensure communities of color hit hard by the coronavirus get the resources they need, lawmakers are calling on the White House to step up its collection of racial data. I'll have that full story coming up.
Southern states making moves to reopen. I'm Kelly Meyer reporting from Washington. What lawmakers have to say about the governor's decisions.
I'm Trevor Shirley in Washington, where Congress is set to approve more money for small businesses. I've got details coming up.
Earlier today, I had a very productive meeting with Governor Cuomo, as you probably saw.
In a phone call with MSNBC, New York Governor Andrew Cuomo called his meeting with President Trump functional and effective. The governor avoided cameras at the White House, but earlier today at his press briefing explained his up-and-down relationship with the president.
He has no problem telling me when he disagrees, and he tells me when he agrees. I have no problem telling him when I disagree and when I agree.
Cuomo said the focus was on testing, which he says is the benchmark needed for reopening his state's economy.
You need to understand quickly who's in a better position to do what.
Cuomo and other governors across the country have gone back and forth with the president about who should be responsible for large-scale testing. President Trump says that's up to the states.
Testing is a local thing.
Cuomo says he agrees that states should be in charge of testing.
Hold me responsible.
But Cuomo says the labs can't do more tests because manufacturers have run out of materials like cotton swabs and chemicals that largely come from countries like China and South Korea. That's where he wants help from President Trump.
Let the federal government figure out South Korea and China and international supply issues. That's the intelligent distribution of responsibility.
Instead of 50 calls from 50 governors, Cuomo hopes his one visit to the White House will get the federal government in gear to help the states get what they need for aggressive virus testing. In Washington, I'm Jesse Tenor.
The president plans to issue an executive order halting immigration for at least 60 days. He says it's to protect Americans from coronavirus and from losing jobs.
And you also want to be able to know who's coming in and who's coming out. So I think it's an action more for the safety of the country than anything else.
House Republican leader Kevin McCarthy says as the economy gradually reopens, new hotspots may emerge. He says the president's temporary order is necessary until the country has a better grasp on coronavirus testing.
We got to get our economy and we got to get it open back up. I think from that basis, we have to understand what's happening along the border.
President Trump said late Tuesday evening the ban won't apply to immigrants with temporary visas. But Democrats say an immigration ban goes against the president's goal of reopening the economy, and they say it fits an anti-immigrant pattern in this White House.
It's just a slap in the face to immigrants.
Congresswoman Judy Chu says international travel is already restricted. She says there's no real policy change. She says the president's tweet is purely political.
This is clearly just meant to stir its own base, stoke more anger and xenophobia, and change the conversation away from his own failings.
Chu says immigrants make up 28% of doctors and surgeons, and 6 million immigrants are considered essential workers.
So they are such a huge part of our frontline workers who are putting their lives on the line.
We reached out to Homeland Security for comment as well. The agency didn't respond. In Washington, I'm Joe Khalil.
It appears the Senate will vote to approve new funding for the Paycheck Protection Program, which doles out grant money to shuttered small businesses to pay their employees during the pandemic.
I think this agreement, this bipartisan agreement today, is a good step.
The deal satisfies Ohio Democratic Senator Sherrod Brown. It includes $310 billion for the PPP, plus an extra $75 billion for hospitals and another $25 billion for coronavirus testing.
I'm hopeful that the House will move quickly on this as they have in the past.
Indiana Republican Representative Larry Bouchon also supports the plan.
The stuff that's in there, I don't have a problem with.
But some House Democrats, including Ohio's Tim Ryan, don't think it goes far enough.
We need $1 trillion at least for small businesses. This money is not going to be enough.
And other Democrats, including some outside of Washington, say they're concerned the measure doesn't include funding for local and state governments.
I get small businesses, I get airlines. How about police? How about fire? How about healthcare workers?
And some Republicans like Bouchon also worry the plan adds on to the country's debt even before all the money from the CARES Act is used up.
But if that's what it takes to get the PPP program replenished, then I think it's a fair compromise and I'll support it.
House members say they expect to return to Washington for a vote by the end of the week. Reporting in Washington, I'm Trevor Shirley.
Shortages at the grocery store are forcing Americans to get creative with their meals, but those who suffer from food allergies don't have the same flexibility. Lisa Gable is CEO of the group FAIR, Food Allergy Research and Education.
Food allergy families already have a level of anxiety. It's never an easy process.
Grocery delivery services are popular as people practice social distancing to slow the spread of the coronavirus. But sometimes those services substitute items, creating danger. But there are ways people can help each other.
When people are in the grocery store and they're making choices, and if they don't, for example, have a dairy allergy, we're hoping that they'll leave things like those optional soy milks or almond milk.
FAIR says people can ask a manager at a store or food bank if they can hold items that are safe for them. An allergic reaction often means a trip to the emergency room. But with COVID-19 adding new risks, Tuesday, Dr. Tom Casale, FAIR's chief medical advisor, issued new recommendations to help avoid an ER visit.
Inject epinephrine, then call for help from a neighbor or someone else where you could be by the front door, unlock it, so that if you did have a severe reaction, someone else could still activate the emergency medical system.
Casale says people should speak to their doctor before trying this. In Washington, Alexandra Limon.
For the first time in history, the price of U.S. oil dropped below zero.
This has gone from, bad to apocalyptic.
Dan Eberhardt with Canary Oil says that means oil producers were paying buyers this week to take the oil off their hands.
Every day that we're producing and not consuming, we are just adding to the stockpile and prolonging an eventual recovery.
Texas Republican Senator John Cornyn says there's simply too much oil and nowhere to put it, and no one to buy it.
And until we can find a place for that to go, it's going to be a really tough time for our oil and gas sector.
There is a place to store it. We have a national strategic stockpile that is not full.
Alabama Democratic Senator Doug Jones says there are options like the Strategic Petroleum Reserve.
And so I think the first thing that we can do is replenish that and make sure that we've got that full to its capacity.
But Cornyn says that's only a temporary fix.
We need to reopen our economy so that the demand will go back up and relieve some of this pressure.
The storage issues, as you know, there's no simple solution to it.
White House economic advisor Larry Kudlow says he anticipates the economy will begin to bounce back as early as June.
You get folks going back to work and you start reopening these economies, I would guess oil prices will pick up, but not rapidly.
Kudlow says the oil industry will continue to feel the pain while it waits for world demand to come back. In Washington, I'm Anna Warnicki.
Beaches and retail stores in South Carolina are beginning to open for business.
I think it's time. I think that every day that goes by, the economic havoc becomes worse.
Republican South Carolina Congressman Tom Rice says he agrees with South Carolina Governor Henry McMaster's executive order that allows some stores and beaches to reopen with strict social distancing measures. Republican South Carolina Congressman Ralph Norman is on board.
We cannot go back into business soon enough.
South Carolina Senator Lindsey Graham took to Twitter to support his governor, but Graham is not happy with his neighboring state, where Georgia Governor Brian Kemp said he'll be reopening fitness centers and hair salons as early as Friday. Graham tweeted that's too fast, too soon. And in Alabama, the governor is also weighing proposals to reopen her state's economy.
Every governor is responsible for reading the numbers and doing what they think is best for their state.
Republican Alabama Governor Kay Ivey says for her state, that means not fully reopening until the state has enough testing. Democratic Alabama Senator Doug Jones agrees.
We really need to ramp up testing big time before we really start opening up in a big way.
Jones called the reopening of some states' economies premature.
If we get hit again, it would be really, really devastating.
He says the scientific data will tell Alabama when it's time to return to work. Reporting in Washington, I'm Kelly Meyer.
We need to have that information.
Michigan Democrat Senator Debbie Stabenow says to help communities hit hardest by the coronavirus, the Trump administration needs to collect more data about exactly who is contracting it.
We're just shooting in the dark here. We don't know, and that's not good enough.
So far, she says 40% of deaths in her state are African Americans.
We are seeing it in St. Louis, we're seeing it in Kansas City, we're seeing it everywhere.
Missouri Senator Josh Hawley says there's a clear racial disparity nationwide, and some areas need targeted help.
We need to search resources every place that is being hard hit.
The CDC just published a new report showing 1/3 of COVID-19 patients are African Americans, but 75% of the patient information collected is missing information on race.
Either states aren't forthcoming with the information or the CDC is not demanding it, like they should be, but it's extremely important.
Illinois Democrat Robin Kelly oversees health policy for the Congressional Black Caucus. She says the administration needs to be more aggressive protecting the vulnerable.
What we want to see, is more testing, more concentrated, focused testing, contact tracing. We want to see results, so rapid response.
Kelly and Stabenow are backing plans to force the administration to step up its reporting. The Trump administration now says a fuller picture of nationwide COVID-19 racial data will be published by early May. In Washington, Raquel Martin.
Give me a second, you'll see I'm going to help the men lower the body. I'm putting my phone down for a moment.
Okay.
It's a question. Your father's name was David. Do you know if he had a Hebrew name?
No, I don't know.
But your grandfather was Mordecai.
Mordecai, yes.
Okay, hold on. When you watch, I'm going to help the men.
Okay, Rabbi.
Usually we average 1 or 2 burials a day. Well, today's Wednesday. This past Friday we did 7 burials. Sunday we did an unprecedented 10 burials. Monday was 7 burials. Yesterday, Tuesday, was 6 burials. Today we're quote unquote only 4 burials.
Lowered your father into the grave, and we're going to cover him now. Now, I would like you to say a few words about your father. Tell me a little bit about his life, where he's from originally, what he did for a living, a little bit about the family. Like 2 minutes.
Yeah, he was born 92 years ago in 1927 in the Ukrainian former Soviet Union city, Kryvyi Rog.
I feel bad for them. I really feel bad for them. They can't even approach and be at the burial of physically at the loved one. And yet I'm amazed many times how many people thank me for doing this, even under these circumstances. They're grateful that they could come and see and view the burial.
You see, we've covered the grave. I'm going to put the nameplate in. Let me just, I don't know if you can see it from here, but I'm going to read it to you. Two Hebrew letters.
I see. I believe you, Rev. I believe you.
Two Hebrew letters, here's buried. I just want you to understand, here's buried, David told God to restore, and 5 Hebrew letters, which are the initials of the Hebrew words to translate, may his soul be bound up in the bond of eternal life, that your Father lives on for you and your family, in your hearts and your memories.
You know, I feel myself like I'm just refreshed to live, like a reborn. A new health.
This is what I call a cul-de-sac community. You know you had to come 2 miles in off a highway. There's no road that runs through our town. So we're a fairly isolated, rural, and stable ecosystem right now for the last several weeks. So it'll be very interesting to see the footprint of the virus in this arena. And then we also have wide socioeconomic diversity, and we have ethnic diversity. It's really unusual in that we're trying to capture the entire community, and we're doing it with 2 tests, the PCR test for viral load to show infection, and also an antibody test. But it's the only way we're going to have the information to safely move out of the restricted lifestyle we're in, and also prevent more deaths from this, which is ultimately what we all want. And we're hearing people getting restless and wanting to just drop the restrictive protocols that are working so well, but they're doing it blindly. If they do it in an unsafe way without data, we risk a resurgence. And so what we really want is to get the data so we know how to give safe recommendations about how to move back into our commingled lives that we all really appreciate.
He just pulled as far over under the shoulder as he could without hitting me. He was maybe 6 inches away. And that happened nearly instantaneously. It was just suddenly there's a guy driving 45 miles an hour a few inches from you. I was just shocked and then more shocked. Like, at first I just assumed he was actually trying to turn around his boss. He kept hammering his horn the whole time until he turned around in his driveway. Then he stopped and started backing up at me. By the time it was actually close enough to hit me, I was just kind of in shock. I don't think the pastor could see me anymore, so I don't think it was necessarily intent to not hit me as much as it might have been luck. When the bus stops is about the time I fully realize what's going on. I don't like being attacked. I don't think anyone does. I'm exercising the same right that he's trying to say. He's going with his First Amendment rights to assemble, and I have my First Amendment rights to protest. I will be there every service that he has until the quarantine is lifted or he closes his doors.
The governor said that we should wear masks, and I think it makes a lot of sense to wear masks anytime we're going to be around anyone we don't know.
The main thing is just things that you're touching with other people. So, like, I have a pack of wipes and stuff that I'm keeping with me, but I got little ones, as you see, so it's just trying to get them out of the house and get them some fresh air.
Yeah, we're really grateful for the parks being open. It's good to just get out and be in nature, stretch our legs, and it's a beautiful day. So we're really grateful that the parks are open.
I'm out today with, my children to come out and get out of the house because we're done with our homeschooling for the morning. And so this is a science field trip and PE all in one.
So what is the name of what you've got? Neuro.
Neuroblastoma. I got neuroblastoma.
Mm-hmm.
In Morristown, they only allow one parent to come.
Which was extremely rough for us because my husband comes to everything with me. Yeah. We got very used to that as our routine and this idea that, and then she had to be in for a very rough chemo and only one parent was allowed to be there. Yeah. And it was, you know, because it's tough.
Yeah, I wasn't expecting that, no.
And it was very sweet. She was talking about that she had put this together and she was thinking about kids like Sophie and what they were going through. So how did that make you feel?
Well, it makes me feel like I'm not alone.
Sarah's just one of some just amazing people who kind of, even in times of tough times, where they're, you know, worrying for their own family or their own life, they think about kids like Sophie who are going through a lot.
Imagine there's no heaven.
Music itself, it started where it was a long spine surgery case, and after the case, I was finishing up and I just started singing in the operating room, and we're just finishing up with everything and turning over the room, as they call it. And some of my other coworkers started singing with me, and it was at that moment that I kind of realized like how special music is to me, because of just how I felt in the moment and how it sort of brightened up the room. And recently, you know, with what's going on with the global pandemic and everyone sort of having their lives sort of derailed, it's been an opportunity for us to step back and say, what can we share that would sort of be something that could bring people together? And music was one of the things that we could do outside of the hospital, outside of the operating room. And that's kind of how the idea got started. I think it reinforces the idea that there's no way that we get through this unless we get through it together. And the project itself, to put the project together like in a day and then be able to share it, I think for us, it's very important to find a way to give with this. And I think if it's a little bit that we can do on our part, I'm happy to do it.
When you're feeling low and there's no one around.
All proceeds are going to be donated to healthcare workers on the front lines and charities focusing on nonprofit foundations for healthcare workers giving PPE. And so it's a group of charities that focus on those things, and that's where all the proceeds are going to go. So even if people hate the music, they should just know that it's going to a good cause every time you play it.
Oh, say, can you see by the dawn's early light what so proudly we held at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still